So let me welcome returning and new participants to the second day of our workshop on physician-assisted death. This welcome is to both those here in person at the National Academies and those participating by live webcast. We welcome all. We had a rich dialogue yesterday with a wide range of strong presentations and strong participation from the audience. The discussion was rich, frequently illuminating, always vigorous, and sometimes contentious, just as it should be. The day was organized into two sessions with multiple parts. The first session considered what we know by examining the evidentiary landscape and its relation to ethical discourse. For example, the distinction and relations between facts and values/ethics. And by attending to the terms of discussion, particularly legal, regulatory, and operational categories for the practice of physician-assisted death, for example, terminal illness and capacity. The second session then looked at provider experiences and approaches. Panel one in this session attended to the current landscape of implementation and practice, including debates about some legal safeguards, whether they're too strong or too weak, the relation between the law's silence about some aspects of implementation and other efforts to develop safeguards, some comparative perspective with the Netherlands, and perspectives from the disability community. Panel two in this session paid particular attention to potential approaches to handling patient request. There were critical questions about the appropriateness of a restrictive approach to patient request. The panelists considered physicians' responses in different contexts, where physician-assisted death is legal, where it's illegal, as well as where the physician is opposed to the practice. I won't try to summarize the content of yesterday's discussion, just flagged several of the topics we considered, in part because the discussion was so varied and rich, and in part because I will note in a moment, the final session today will seek to identify takeaway messages and lessons for data collection and research agendas from all the sessions, including the ones we held yesterday. So our plan for today, the first two sessions on the agenda 3 and 4 seek to broaden the context and discussion in two ways. Session 3 places the practice of physician-assisted death in the U.S. In broader context of palliative care and hospice, and of long-term services and supports, both of which, particularly palliative care and hospice, have already been introduced along the way in the workshop. The goal is to learn as much as possible about the interaction of both of these with physician-assisted death for better or worse. Session 4 both sharpens and broadens the discussion of the evidentiary base by examining the strengths and weaknesses of data collection in the U.S. In comparison with data collection in Canada and the Netherlands, both working with more expansive notions of physician-assisted death. Then session 5, our concluding session, will have two parts. First, observations from or regarding the workshop with responses by proponents and critics of physician-assisted death. And second, reflections on evidentiary gaps and key takeaways from the workshop with a view toward identifying potential next steps in the area of data collection and research agendas. In this second part, chairs of all the workshop sessions will focus on the main lessons from their sessions before we conclude with what we hope will be 30 minutes of open discussion. So just a couple of announcements and housekeeping matters. We will have a morning break and a lunch break with boxed lunches again provided. The workshop will adjourn at 3 o'clock so people can make their travel arrangements. I should also note that a few new handouts were added to the registration table yesterday afternoon and this morning. One is the updated agenda for today's session. The other handouts were made available for distribution at the request of speakers. So I'll repeat the point I made yesterday. The documents provided by speakers are not products of or endorsed by the National Academies, but are provided to further inform workshop discussions, again, at the request of speakers. So we'll now turn to session 3, physician-assisted death in the broader context. And I'll turn the chair over to the floor over to 3 co-chairs of this session. James Tulsky, Dana-Farber Cancer Institute, Richard Payne, Duke University, and Joanne Lynn, Altarum Institute. They'll lead us through the session.